Looking at here with as Zach started to introduce what's different for 2022, it really ties into a couple of the pieces we've heard from both people who are still uninsured as well as people who are still enrolled directly with the insurance companies. For people who are still directly enrolled with the insurance companies, I know they've talked. There's been a lot. Both Blue Cross and MVP have done a lot of outreach to members to make sure that they know that now people who have incomes up to $105,000 and are on a single plan can now get lower costs if they sign up through Vermont Health Connect. Just a year ago, that threshold was about $50,000, $51,000. So you have an income more than twice as high as you could have a year ago and get lower costs now. And people who have lower incomes and were getting financial help before can get a whole lot more now. And we're not talking. One of the things we've heard too, I think with some of the insurance companies heard, is that people don't want to, deal with the red tape or take the time to sign up with Vermont Health Connect. Certainly can understand that, appreciate that, particularly if they're talking about 10, 20, $30 on the line, but really want to make sure that people know that you're talking about big bucks here. Again, depending on which household size and income. But as an example, a family earning as much as $150,000 could get tax credits for more than $1,000 per month. So you're talking about by signing up through Vermont Health Connect, you're going to save more than $12,000 over the course of the year. Compared to signing up with the insurance company and not getting those tax credits. If your income is below $150,000 as a family, you'll be getting even more money than that. You can apply it to any bronze through platinum plan, any metal level plan. So I know time is money, but if you're not Jeff Bezos or or somebody else that's making tens of thousands of dollars an hour, it's probably worth the time. And we'll talk a little bit through. You can, for these final days, you got to call the customer support center. We'll put the number up. Zach had it up on the last screen, 855-899-9600. But you can also get information if you go to vermonthealthconnect.gov. Right at the top, there's info on how to apply, and that will get you what documents and things you need to make that application process as painless as possible. But again, the amount of money we're talking about is really going to be worthwhile for a lot of people to change over to Vermont Health Connect or sign up as needed. Another piece that's new for 2022, and for people that had been direct enrolled since the early days of the marketplace, as you'll certainly remember, there were problems, errors, technical issues were quite common back in 2013, 2014, 2015, and a lot of them had to do with the payment system. People had to pay Vermont Health Connect. Vermont Health Connect then paid the insurance companies, having all those computer systems talking to each other. Took some time to iron out. Fortunately, and so some people that directly enrolled with the insurance companies had rather not just like dealing directly with the insurance company, want to keep doing that. And the good news is now, whether you're signed up, whether you're enrolled with the insurance company directly, or whether you're signed up with Vermont Health Connect, starting last month actually with the payments for January 2022, everybody is paying Blue Cross and MVP and Northeast Delta Dental directly. That you get a bill each month from your insurance company or insurance companies, and you pay them directly. So you really just need to sign up and enroll through Vermont Health Connect in order to get the tax forms, the tax credits you need, and the discounts if you're taking them as an advanced payment to have the lower costs each month. That way, Vermont Health Connect can forward those payments on your behalf to your insurance company, but your portion you pay directly to the insurance company. So teeing those parts up, I think we'd love to hear. We do have a couple comments that people have shared, questions and stories. I think, Zach, we can flip to the next slide. Really appreciate people that that logged on and shared their stories, their reasons for not having health insurance or for still being direct enrolled. And we've heard from several Vermonters. We've also heard from several assisters who work with signing up Vermonters. And there's been a few themes to emerge. And I think, Zach, should we give an overview of the themes, or should we jump into some of the posts? We really want to hear people's stories. How do you want to take that? Do you want me to give a quick overview of these, and then you can jump into the specifics, or specific examples?
I'm fine to. I can give a quick overview, Sean, and then just trying to get that screen back up, and then we can jump into. I think that'll be a good segue into some of the questions. And I think, Sean, maybe what we can do is have you elaborate on some of this stuff as the questions roll in. So if that works for you.
Yeah, that sounds great.
So right, like Sean said, what we've heard a lot about is these 6 themes, and certainly they're not exhaustive, but these are the things that we're hearing a lot about from customers and from assisters. So number one, that people have an offer of employer-sponsored insurance, which means, if you have affordable employer-sponsored insurance, you can't get any subsidies through Vermont Health Connect. And while people, get that employer-sponsored insurance, the calculator might say it's affordable, and there is a calculation tool on our website. They might not feel it's affordable, so we can address that a little bit. And then why take time to apply for health insurance when hospital financial assistance programs cover most of the expenses? And this is a tricky one. Some people are familiar with various organizations that do have some financial assistance through the organization outside of the health insurance. Generally, those are financial, dependent on financial need and have some kind of sliding scale. But there are some reasons why people might want to consider getting health insurance, even though there are these financial assistance programs. But that does kind of add another layer of complication. So would prefer to take risk of good health to buying health insurance, and the fallback would be to negotiate a financial contract with the hospital. So kind of this idea that people are in pretty good health and they don't want to have to pay that additional money, if they're not going to use their health insurance. And if they did, they would try and negotiate some kind of payment plan with the hospital. And so we've heard a little bit of that. And there are probably some considerations that Sean will want to elaborate on when it comes to that. Another one that we hear is that folks don't want to have to report updated income and risk their child losing Dr. Dinosaur, which is, a totally understandable concern. I think this idea that, look, I don't want to make any changes because I don't want to mess anything up. Things are, stable the way they are now. And if I make a change, it could really jeopardize my child getting their Dr. Dinosaur coverage, which is the most important thing to me. And I think that is an understandable kind of apprehension or worry that some have, but some pieces to that we can probably counteract and help soothe the concerns on. Another one is the plan selection piece. So this idea that we've got 26 plans out there, and it's just, I don't know where to start. It's really overwhelming. We do have a video town hall, actually our last town hall that focused on how to select these plans and how to pare down the plans. But that's another thing that we certainly don't want to be a piece that discourages folks from choosing health insurance over none at all. But that is something we've heard. And then that, the plan designs aren't perfect, and they wish so kind of the opposite end of the spectrum, that the plans aren't what they want them to be, and wish that they had better options. So I think because we've got some specific questions from our attendees on the line today, I want to get to those first. And one of the ones that I think we should publish first and talk about is the one that I just sent published. So hopefully folks can see that. And it's about someone, and Sean, maybe you can help answer this question. So this person used to have health insurance through Blue Cross, and it was really expensive. They then became jobless and told they wouldn't qualify for a catastrophic plan. And so now they are feeling like, they can pay less when they just pay out of pocket, I guess, without the insurance. And it seems to me like, to this question, it might be a good time to revisit kind of when people might be eligible for Medicaid and what those special events would be that folks can actually apply for Medicaid if they are in a situation where they don't have any income.
Yeah, that sounds great. Thanks, Zach, and thanks so much for the person that shared this detailed story. I mean, this was part of the reason we wanted to have this town hall and this listening session of knowing where we are this late in open enrollment, and that we've talked a lot in the other town halls, and knowing that some of the reasons, like the thing like the employer-sponsored insurance that you referenced, are pieces that are still kind of glitched, and people might fall through the cracks, actually not qualify for help. But there'll be other instances where it might be a misunderstanding, and people might be able to qualify. And so there's a few elements going on here with this person who posted. Number one, where they said they made decent income, I think you said back in the first half of 2021. So think that would impact their ability to get financial help or a lower cost in 2022. That's actually not the case. For better or for worse, in this case, for better, the way that the financial help works is based on the income you expect to earn in the coming year, in tax year 2022, for people that qualify that don't qualify for Medicaid, people that have an income too high for Medicaid, that have an income that's that would give them a qualified health plan. But actually, I should probably back up, because given that question, if they're jobless and they have a low income, if their other income sources are very low, it's very possible that they'll qualify for Medicaid. To qualify for Medicaid, it's based on your current month's income, your income right now. And so you're required to report an income change within 10 days of having that income change. But if you applied today, and based on your income for this month that's coming in, they may have to verify that income. But with Medicaid, you would actually have coverage retroactive to the first of the month. So even though we're after January 1st, you could potentially have Medicaid starting January 1. Then if you get another job, say it starts in March, you'd have to report that new income within 10 days. Your income at that level might be higher than the Medicaid threshold, and you might then enroll in a qualified health plan. Even though it wouldn't be open enrollment, you'd have the ability to go in and get that plan with the tax credits, because you would have had a loss of other coverage within the last 60 days. You'd be coming, in that case, right off Medicaid. And so that's an important thing, and I'd highly encourage this person right after our town hall, or even if you want to hang up on our town hall and call right now, to do that, because I think you have a good chance of enrolling based on what you say on Medicaid. If you have other income sources that would be too high to qualify for Medicaid, then you would still be able to get income-based subsidies based on what you project your income to be for 2022. It doesn't matter what you earned in 2021. Your 2021 income would be reconciled if you did receive any tax credits for 2021, just like tax credits you receive for 2022 will ultimately be reconciled when you do your 2022 taxes a year from now, the winter of February, March of 2023. So if you project your income to be higher than it actually ends up being, you'd get even more tax credits when you file your taxes. If you project it to be lower and you earn more, you would have to reconcile again when you file those taxes, but you'd be able to get that financial help. And if you're unsure, a lot of people want to err on the side of not taking the full amount of the tax credit. Maybe they qualify for $1,000 a month in tax credits based on what they think their income will be for 2022, but they know there's a fair chance they'll get a job that would be paying a lot more. So maybe they only take $500 a month in financial help. So that's a piece to look to. The other thing I wanted to address from that comment was they referenced two more things. One, they referenced that catastrophic plans, that they weren't eligible for them. To sign up for catastrophic plans, you generally need to be under 30 years old. But even for people who are under 30, I would highly encourage them to not just think catastrophic is the way to go, because with catastrophic plans, you can't get those tax credits, the financial help that, as we mentioned, to people up to $105,000 in single plans and nearly $300,000 in income for family plans can now get. And so in looking at it, for couples earning fairly high incomes, couples earning up to $116,000 as a couple, they'd be able to get a bronze plan after their subsidies for an even lower cost than a catastrophic plan, because they're even at $116,000, the amount of financial help they're getting would lower the cost of that bronze plan, which usually costs a good bit more than a catastrophic plan, to be less than the cost of the catastrophic plan. So I know it's a lot, throwing numbers at people here, it's a lot to figure out. If you haven't already looked at the plan comparison tool, would highly encourage you to go to vermonthealthconnect.gov, click on the plan comparison tool. It has a picture of a shopping cart. You can go back, look at some of our other town halls. We've done some tours of it as well. But it's pretty easy. You can walk yourself through it. There's a little video there. Yep, Zach has the screen up here, that shopping cart. You can see here that plan comparison tool link will take you right in. And if you put in what your income you think will be for 2022, your household size, a little bit more information, it will show you those options. And as I mentioned, unless your income is really high, there's a good chance that you'll get enough financial help to make a bronze plan even more affordable than a catastrophic plan. The last thing I just wanted to mention, I know that this person referenced, and some other folks have too, just about the high cost of healthcare, and that's, I think, a clarification we want to make here. We're talking in Department of Vermont Health Access. Our job with the marketplace, with the eligibility enrollment, with open enrollment, is to try to make more affordable healthcare more accessible to more Vermonters. It's not dealing with making the healthcare system as a whole more affordable, which generally is the same thing that the Affordable Care Act did. The Affordable Care Act did have some measures. Insurance companies weren't spending excessively on administration and on advertising and marketing and things, that they were plowing most of the money back into the actual cost of healthcare. But for the most part, the Affordable Care Act focused on trying to make health insurance more accessible to more Vermonters. So there's obviously a lot of work that needs to be done to make healthcare itself more affordable, to bring down the cost of healthcare. There are other entities in Vermont and nationally that are working on that. But here, and particularly at Open Enrollment, we're just trying to make sure that Vermonters are covered and protected. And here in the middle of a pandemic, which certainly doing nothing to make the cost of healthcare, drive the cost of healthcare down, as we can see with the pandemic. There's a lot of costs, a lot being spent on healthcare, but at the same time, there's a lot of risk. We want to make sure people are protected and have that peace of mind that comes with health insurance.
Thanks, Sean. And I thank you for those attendees who called to our attention the technical issue. I'm not sure if Sean noticed, but we did have a little bit of a technical issue at the beginning. So thank you and for your patience in dealing with that. And I just want to, because of that, it sounds like the first several minutes may have got cut out. So I just want to make sure that people are able to review these important dates around open enrollment. So open enrollment is still active until January 15th. It means that until January 15th, you can enroll in a plan starting on February 1st. Now, I also want to go back to what Sean mentioned in response to the last question about Medicaid eligibility. So, open enrollment is for qualified health plans. And if someone is deemed eligible for Medicaid, they can actually enroll at any time in the year. That there is not an open enrollment period for Medicaid. So if you at any point during the year, and I won't go into the details as Sean laid out, but because it's determined differently, you can actually enroll in Medicaid at any time in the year if you're eligible. So you don't need to wait until the open enrollment period. So that's a really important takeaway for folks to understand. If your income does drop to a level where you'd be Medicaid eligible, you don't have to wait until the next open enrollment period to apply and to transition from a qualified health plan to Medicaid. And that really speaks to the point that Sean was talking about around trying to make health insurance as accessible and affordable for all as possible. So I do want to go to the next question. And I will actually say, I'm glad I reminded myself before I left this slide that January 15th is a Saturday. So if you missed it the first time around, our call center is open from 8 a.m. to 1 p.m. on that Saturday at 855-899-9600. And if you want to talk to someone about your options, we have trained folks who can walk you through your personal situation and help you determine for what plans you might be eligible and what subsidies you might be eligible for. So on to the next question we have. I'm on Medicaid now, but I have a new job. I will be a permanent employee at the end of February. If I do not become a permanent employee, I will have missed this opportunity to choose a plan. What should I do? So I think this is kind of a question around maybe employer-sponsored insurance, but I think maybe, Sean, it's another opportunity to kind of revisit special enrollment periods and the difference between choosing a plan through Vermont Health Connect, a qualified health plan, versus employer-sponsored insurance.
Yeah, absolutely, Zach. Yeah, this is a great question. I really appreciate the person who asked this. And as Zach referenced, the difference between open enrollment and Medicaid enrollment, but also the difference between open enrollment and special enrollment periods. And so this person here definitely doesn't have to worry about potentially going uninsured, but they should call because anybody who's on a qualified health plan enrolled with Vermont Health Connect, if your circumstances ever change, household, if you get married, have another household member, or if somebody gets a raise, loses a job, have a change in income that way. With qualified health plans, you're required to call within a month of that change and reporting it. With Medicaid, you're required to call and report that change, or log in to self-serve if you have an online account and report that change within 10 days. So with your new job, I would encourage you to call, today, tomorrow, whenever you can, to report that change or put it on your online account. Now normally, what would happen would be if your income was over the level that you would have to qualify for Medicaid, you would receive a notice that your Medicaid was going to end on coming date, probably the end of the end of the month or the end of next month, depending how it's processed and worked there. But you'd be given a date for when it would end, and you'd be given the option for signing up for a qualified health plan through Vermont Health Connect, and what the subsidies would be for that. And this time, since we're not in normal times, we're in pandemic land, and there's actually a pause on Medicaid redeterminations throughout the end of the public health emergency. So even if you call today or tomorrow, say, have a new job, here's my income now, even if it shows that you wouldn't be eligible for Medicaid anymore, you'll still be staying on Medicaid because nobody's being pushed off Medicaid until the end of the public health emergency. So in your case, with this specific example of, it'll be the end of February that you find out, we'll still be in the public health emergency. You'll still be on Medicaid through then. And so what will happen is, if you become a permanent employee and you're offered employer-sponsored insurance, great, you can get your employer-sponsored insurance and go from there. If not, when the public health emergency ends, everybody, just like everybody else on Medicaid, whether their income is now over or whether it's still under or anything else, everybody gets redetermined each year, and you'll be contacted about that. At that time, whether it's May or whether it's June, doesn't matter. If it's during open enrollment, not during open enrollment. If you are found to be not eligible for Medicaid anymore, you would receive the notice, kind of as I mentioned in normal times that you would have received this month. So you'll be receiving that several months out. And so if you're not a permanent employee of your new job and don't have other health insurance at that time, whether it be the summer or whenever the case may be, you would have the option. You would have 60 days from the time that your Medicaid was ending to sign up and choose a plan. Now, in those cases, we highly encourage people to sign up right when they get their notice, so that you don't have a gap in coverage, because with qualified health plans, you sign up respectively. So if you were told that your Medicaid was going to end on July 31st, you'd want to call and sign up in July for a qualified health plan that would start August 1st. If you waited till September 15th, you'd still be within the 60-day window, but your plan would start October 1st. So that may have been more details than you needed or wanted to know. I think the bottom line is, don't worry about it. Call up, report your new job, make sure that Vermont Health Connect has the right information. The other really important thing I should mention for everybody on the phone, whether they're in a qualified health plan or on Medicaid, is to make sure that Vermont Health Connect has your cell phone, has your email, has your mailing address, because with the mail that goes out, if we just have people's mailing address, if they move and forget to report it, that mail gets bounced back. If there's no way to contact people, at the end of the public health emergency, they could lose their Medicaid, and not know that they lost it. So we'd highly encourage everybody both to report the change, make sure your income and everything is up to date, but also that your contact information is up to date too.
I'm really glad you brought that last part up, Sean. Thanks. And I think that's, this ties right into what we've been talking about. The next question asks, is it too late to sign up for 2022, or do we need to just call as long as we haven't purchased private insurance yet? And I think it's a pretty easy answer, Sean, right? That, if it's a qualified health plan that you're looking for, you can definitely apply until January 15th. Your start date would be February 1st, and that's for a qualified health plan. If you're Medicaid, obviously you can apply at any time. But is that right, Sean?
Yeah, no, you hit the nail on the head, Zach. That's exactly right. And the one thing I would qualify was just the way they qualified that is they said that they just need to call as long as we haven't purchased private insurance yet. I would say even if you have purchased private insurance, if by private insurance you're referring to that you went to MVP or you went to Blue Cross and you directly enrolled with them in a plan, but that your income is below those thresholds we were talking about. If you're in a family plan and your income is under $297,000, or if you're in a couple plan and I think it's what is it, $210,000 or something like that, I think for a couple plan. If your income is below that, even if you did already sign up with MVP or Blue Cross, you can call Vermont Health Connect and transfer your plan right over. You just want to make sure, look on how you signed up with Blue Cross or MVP to see which member of your household you put as the lead, you put as the subscriber. The bill comes in their name. And you want to call up Vermont Health Connect, say you want to transfer your plan from MVP to Vermont Health Connect or from Blue Cross to Vermont Health Connect. It'll be the same plan. You'll still have that same insurance company. You'll still get your bill. You'll still pay the insurance company, as we were talking about a little bit before, but you'll be able to get those lower costs with them. So yeah, short answer, like you said, it's not too late. If you haven't signed up at all, don't have health insurance, you can do it by January 15th. If you've signed up with MVP or Blue Cross, you don't have to call us by January 15th. You could call us on the 20th or 25th or next month or the month after. You can do it at any time during the year. You can transfer a direct enroll plan to Vermont Health Connect. The reason you want to do it before the end of the month is that those tax credits are per month. So we gave that example before of a household that was a family plan, folks earning $150,000, they can get over $1,000 per month in tax credits. So if they had signed up, last month with Vermont Health Connect, they'd be saving over $12,000 for the course of the year. If they call today or anytime before January 31st, they'll be saving money from February to December. So over $11,000 for the course of the year. You wait to November, you can still do it, but you're only saving $2,000. You've left over $10,000 on the table. So for people who are direct enrolled, that's really the impetus. You're not tied to open enrollment, but definitely better in your interest to act sooner rather than later.
Thanks, Sean. Great questions and more great questions actually rolling in. So I want to make sure we get to them. So we've got a question. Does it impact eligibility if you apply as two married people on one plan or two married people on two single plans? And I think certainly for financial subsidy, there would be a difference. Is that right, Sean?
Yeah, well, it's a good question. And actually, the question there I think was related to were they asking about being in two single plans versus a couple plan?
I think that's the case.
Yeah. So if that's the case, it doesn't matter. But what does matter, and we should definitely underscore this, is that, and you'll get this when you try to apply as well. As we talked about, it's prospective. It's what you expect to earn in 2022. And you have to plan to file your taxes. If you're married, you have to plan to file your taxes filed jointly, married filed jointly. You can't do married filed separately. It's by tax household. So if you're if you're living in the same house with somebody, but you're not married and you file separately, you file as individuals, you have two separate tax households, then it's fine to to sign up accordingly. But if you're married and file separately, it's fine if you're going to file separately for, if you did last year and even these taxes you do next month, if you want to file separately for 2021, because you weren't signed up with Vermont Health Connect in 2021, that's fine. But to get your tax credits for 2022, you have to plan to be married, file jointly when you file your 2022 taxes next year. So that's the piece that is important. The other piece, as Zach referenced, there are reasons that people may have two single plans. A married couple may want to have two single plans rather than a couple plan. Maybe one is healthier and is comfortable with some risk, wants to take that bronze plan that would have a higher deductible, higher out-of-pocket costs but that their subsidy might completely cover the cost of that plan, whereas the other spouse may know that they have some medical procedures coming up, or may have some prescriptions, may want to be on a gold plan, or a plan deductible lower out of pocket. And you absolutely can do that. And you'll see that if you have kids, you'll see that there's a bit of a discount in kind of having a parent-child plan or having a family plan. But the couple plans cost twice as much, as a single plan. So that's actually something that a lot of folks do. They sign up together, they get that eligibility determination together, as we said, based on what their tax household income will be for that coming year. And then that subsidy is just applied to the cost of those two single plans. They could be one with Blue Cross and one with MVP. It could be two single plans with Blue Cross, or two single plans with MVP, whatever the case may be. But great question, and certainly something you can do, and something that the folks at our customer support center, you see the toll-free number right here and the hours for the remainder of open enrollment. They're very used to helping people sign up in two single plans who want to go that route.
Thanks, Sean. And we've got 4 questions left, and I would encourage you to keep them coming, but we'll try to get through them all in the less than 15 minutes we have left in today's town hall. And just a reminder, this is recorded so that you can go back to it and refer your friends and family, colleagues to it. So next question, if we're already enrolled in an MVP plan now, we find out we want to switch to one of your plans, can we still do that? And I think that if I'm reading this correctly, there's a couple kind of questions back to this person I would have, and that the first one would be, if you're already enrolled in an MVP plan, do you mean directly enrolled in an MVP plan without just kind of going directly to the carrier? Or are you talking about employer-sponsored insurance? And if you wanted to switch to one of our plans, meaning you want to come through Vermont Health Connect, just to clarify, Sean, all the plans are the same for the most part, right? It's just about how you pay and kind of enroll directly through the carrier versus enroll through Vermont Health Connect, where you'd be able to get those subsidies. Is that right?
Yeah, that's exactly right. Yeah. So when you say MVP plan or our plan, we don't have plan designs per se. It's Blue Cross and MVP plans that you can sign up with through Vermont Health Connect, or you can sign up with the issuer. And Zach's exactly right. Regardless of whether you have that MVP plan with us or directly enrolled through MVP, you can change to another plan through January 15th. So we said even after January 15th, you'd be able to transfer that plan over to Vermont Health Connect if you're direct enrolled, but you wouldn't have the option of changing plans anymore. Up until January 15th, you can change plans if you want to, whether you can be signed up with us or you can sign up directly with the issuer. Either way, you can change your plans. You could change to another MVP plan, or you could change to a Blue Cross plan. You can do anything you want between now and January 15th. One thing I do want to underscore on that, though, is if you change to a different plan between now and January 15th, and you're already in plan, in your case, you say MVP. If you change to another MVP plan and you've used some of your healthcare this month, you've paid something toward your prescription deductible or toward your medical deductible, and you change to another MVP plan, whatever you've already paid toward that MVP plan deductible will transfer over. They'll give you credit for that toward your new MVP plan. If you change to a different to a Blue Cross plan, anything you paid in January won't count. You'll be resetting. You'll be starting with a 0 toward your deductible as of February. The same thing would apply if you were signed up with Blue Cross right now and you change to another Blue Cross plan. They would give you credit for anything you paid in January. So that may be a reason, maybe a consideration for people to look at the other dozen plans that the insurance company you're with right now in January offers. But if you haven't paid anything toward your deductible, you could look at all 26 plans.
Thanks, Shannon. I'm just putting up that that page again with the contact information if you need to go on our website or contact our call center. But in the meantime, we have a question about in estimating your income projection. It has always been difficult for me to project it because my business earns a different amount each year, and I can never tell if I'm supposed to take into account depreciation in estimating my income. And this individual has had trouble getting an answer when they call. So Sean, are you able to answer that question?
Yeah, on that side, it's a great question, and I think particularly for people who are sole proprietors, or if they run a small business that doesn't offer insurance and come through Vermont Health Connect, it certainly can be tricky, and it's a frequent question of how to estimate that. It sounds like you've been looking at it in the past. I'd give kind of a short answer, which may or may not help much, and a referral. The short answer is that for most people, if you look at the taxes you already paid, which I guess would be your 2020 taxes that you paid sometime this spring or summer, what your AGI, with the line there that has the adjusted gross income, that's going to be a pretty good estimate, pretty good approximate of what your income would have been deemed to be if you had gotten financial help in 2020. Obviously doesn't help you exactly answer the question for 2022, but that's that bit of the prognostication of what's in and what's out, is what's in the adjusted gross income. It's not exactly AGI. The official definition is modified adjusted gross income that the IRS looks at in determining these federal tax credits that that we offer. We pay them to the insurance companies on your behalf, but they're not our money. It's federal money coming from the IRS and federal law, and they're the ones that set the specs with the modified adjusted gross income. But for the vast majority of people, AGI is the same as MAGI. And if you have questions about exactly what they are, if you have a tax preparer or an accountant, they'd be able to look at those specific examples. The short ballpark would be looking to see what your AGI on your taxes has been in the past, and if you expect that to be similar or up or down in the coming year. And just the last thing I would say to that is a point I made before, is if you're not sure, take the approach the same way that somebody might take if you're on payroll and you're the number of exemptions you can claim. People that want to get money back at tax time tend to claim fewer exemptions, so they have less money taken out of their their taxes each pay period. I know it's different. You don't have pay periods when you're sole proprietor, but it's similar to that notion. So if you look at what your AGI was in 2020, you think it's going to be about the same in 2020, maybe it'll be up 10% or something. You make that adjustment, you report that, work that with the customer support center. You're found to be eligible for, say, $500 per month in premium tax credits. You can take anywhere between $0 and $500 per month as an advance payment. So maybe in that case, you only decide to take $300-400 a month, whereas you could be taking $500, knowing that there's a good chance you'll get a refund check when you file your 2022 taxes, or maybe you take it all up front, but you just keep an eye on how your business's income is looking over the course of the year, and you call to adjust in May or June. I'm not sure if that's helpful, but I think as I said, really to get in the weeds and more helpful than that, tax preparers and accountants are best situated for those questions.
Thanks, Sean. And see if we can get through these last questions. towards the, as we wind down here. So my wife gave birth during the pandemic, which allowed her and the kids to stay on Medicaid through the public health emergency. And I have MVP off the exchange, which I think probably means direct enroll. Although I'm not sure. Should I just switch to Vermont Health Connect now? Yes, because it would be off because of that question. Should I just switch to Vermont Health Connect now and wait until the public health emergency ends and then add my wife to the plan? Or can the family not be combined later in the year? So that's kind of a more technical.
Yeah. Yeah, I mean, the short answer is they can definitely be combined later in the year, and depending on what your income and situation is. As I was saying, I think it would make a lot of sense to call this month, you transfer your single plan over to Vermont Health Connect. That'll help you maximize the tax credit you can get, and then when the public health emergency ends, and your spouse and your kids and their Medicaid or Dr. Dinosaur, they'll have that opportunity to come over, and it's an integrated system. So the folks at the customer support center will be able to see your plan that way. They'll be able to add your spouse and kids to the plan. The kids might stay on Dr. Dinosaur, and you and your wife would move to a couple plan. Your wife would have the option of getting another single plan. Maybe the kids would be on a family plan depending on income. There's a few options and scenarios, but in any event, yeah, transferring over now is a great way to go. Thank you.
And on another kind of technicality issue, someone asks, I live with my brother. We own the house together. He makes $150,000 and has health insurance through his employer, healthcare through his employer. I make $50,000. Do I need to include his income as part of the household income? And I guess this would be on my application for health insurance.
Yeah, assuming you're separate tax households, which I think you are from what you described. It sounds like you're separate. You don't file your taxes together. Then no, you wouldn't report his income. I know for some of the things with the state, like for the property tax credits and things, it's everybody living in the in the physical house. That's different. With the marketplace, it's all about your tax household. It doesn't matter who lives in that physical house. So
thanks, Sean. And I think we're gonna get them all in here, because this last one I think is going to be an easy one for you. Can you tell us the salary limit for a single person to qualify? And I think that means qualify for financial assistance. Obviously, anyone can apply for a plan, right? But it's really the eligibility is more around, or the eligibility for subsidy is capped at a certain income.
Yeah, absolutely. Yeah, well, and we'll do lightning round. We got 3 minutes left. If people want to throw in another question or two, we'll hit them all. But right, yeah. So the question, the person that asked that for an individual, it's an income up to about $105,000. It's actually a little higher. I think it's about $105,700 or so. What I should flag there is that one of the kind of big problems in the past was that there was a big benefit cliff. And that would be right at 4 times the federal poverty level, which for an individual is about $51,000. For a family of 4 was a little bit over $100,000. And the way the subsidies were calculated was you could be getting thousands of dollars if you were a family of 4 earning $100,000. You earned a little bit more than that, you got nothing. What the American Rescue Plan Act did was replace that benefit cliff with a phase out. So somebody at $105,600, is maybe going to get like $1 off each month. It's not going to be much. And so for those people who don't want to apply, if you're earning over $105,000 and you're direct enrolled, don't want to bother with changing, I get it. But if you're at $100,000, if you're at $90,000, less than that, it's going to start to be pretty significant and definitely worth your while in changing over as somebody who's an individual. Similarly, if you're a family earning $296,000, not going to be a whole lot of financial help there for you. You're close to that phase out point. But as we talked about, if you're at $150,000, you're getting over $1,000 per month, or saving more more than $12,000 per year by being in the marketplace.
Thanks, Sean. We do have a couple other more kind of comments that I just wanted to address. Someone asked about why this has to be so complicated, and totally sympathize with that. I think that's part of why we're trying to get this information out as best we can. The website is updated frequently, and we are continuing to try to make improvements to it to make that information as approachable and accessible as we can. Please, we always welcome suggestions to improvements there. If there are things that you'd like to see on the website that you don't see, you can email us at our at the email address found on the website, and we'd be happy to take that into consideration. Again, we know this is complicated, and that's why Sean and I have tried to dive into these webinars, these town halls, to make this information as accessible as possible. And unfortunately, a lot of this stuff is tricky to explain in a 30-second soundbite, so it does kind of get a little bit long at times, but we hope that with all the recordings and the social media posts and the information on the website that there's multiple avenues that people can access this information. That being said, I did post a link in the chat to our town halls. It includes 6 videos. It'll include 6 videos after today of our town halls from Open Enrollment. There's also town halls around the American Rescue Plan Act, so you can learn more about how all those enhanced subsidies work. And there's all other resources there, like one-pagers and kind of brief articles and things that people can use for themselves, or even pass on to their network. So this has been a great town hall. Definitely fantastic questions posed by our attendees. Thank you all so much for joining and tuning in. Thank you, Sean, for being our expert on demand. Hopefully we can do this again sometime in the not too distant future. But remember that open enrollment does go until January 15th. And please call us, ask questions to our call center, or email us, and go to our website to find out more information. So, Sean, I don't know if you have anything else before we sign off for today.
Yeah, I mean, the final word I would just say would two things. One, to that question of it all being complex, a lot of it, right, is the federal rules and where Medicaid federal law coincides with everything else. So to the extent we can communicate it better, that's within our control. We appreciate your feedback. We also should mention we have in-person assisters. We talked about them a lot in the past town halls. Now, with only 10 days left, knowing schedules are booked up, we focused more on making sure people call and get in the door. But as you look forward to future years and understanding it, in-person assisters work in all 14 counties of the state. They're a great resource. The final thing I would just say would be, part of the reason Vermont's achieved such a one of the lowest uninsured rates in the country, 97% of the state having health insurance, is because we really, we have a tradition of looking out for our neighbors, looking out for fellow Vermonters. And I think as we try to get the word out about these changes that make more financial help available to more Vermonters, we really appreciate the work that everybody's doing in the communities. And so to the extent that you have any cousins, aunts, uncles, neighbors who might not have health insurance, and you can help share the word to them, encourage them to call Vermont Health Connect in the next 10 days. That'll be helping our fellow Vermonters, and that's something we appreciate all of you for doing. Thank you.
Absolutely, thanks, Sean. And that will conclude our 4th Open Enrollment Town Hall. Please tune in on the website to get a recording of this, and thank you all for attending. Happy New Year and take care.